Hello, my name is Professor Muehlinghaus. I've been able to teach anatomy and physiology for the past 12 years, but I've also been a chiropractic physician, and I've been able to work on Bill Romanowski for the past 10 years approximately. And his claim to fame is that he played football as a linebacker for over 17 years without ever missing a game, which of course makes him had to receive a lot of therapies that are very helpful to combat injuries that he does get and pain that he does get. And so I've been able to learn from him a lot of what works and what doesn't work in the pain management treatment modalities. And so I have a patient that I want to hear real quick from, that we've worked on her knee, and she's had knee pain, and we've treated it conservatively chiropractically, but then we also went into the movement apparatus from the muscles perspective. And so let's hear from her, and then I'll be back to explain to you what I did.
Tell me, what was your problem?
My knee, my right knee.
How long has it been a problem?
Maybe about for 6 weeks or so.
6 weeks or so?
Yeah.
And then we did some regular treatment with some joining and stuff, and at some point a few visits ago we started doing muscle stimulation.
That's right.
And how'd that go?
After the last treatment, it went excellent. I am able to move my knee. I even went biking, and I don't have pain.
So you're ready to start putting more pressure on it?
Yes.
Excellent. Thank you.
So what we did with this patient is we definitely initially worked on the joints, the knee joint, the ankle joints, of course also up in the hip and the pelvis and the lumbar spine. And not to forget, of course, the neck joints, those are very important. But then we went straight into the muscles and we tested the muscles from a perspective of functionality. Because when we look at treatment, what we want to decrease pain medication, decrease pain, of course, but also increase function. That's a big deal for people to be able to be moving. And so on her, what we found is we found some muscles, some quadricep muscle in the front here on the side, but then we also found some adductor muscles that come on the inside of the thigh down towards the knee. And we were able to stimulate those insertion points where the muscles goes into the bone with reflex points and combine that with some acupuncture reflex points also. And after that, the muscle function comes back because the brain will talk more back with the muscle and use it in the movement pattern. Because somewhere in the past, that muscle has been reduced in movement and the brain's not activating it because maybe it's causing pain when it moves it. And so the body says, nah, we'll not move it because we don't want the pain. But now what we've been able to do, we've been able to bring it back, and then of course the whole function of the whole knee is better. And for her functionally, she can move again without pain. And that's great. So thank you for listening.